Hi everybody, Brodie Myers here. We are so excited to be bringing in the new semester at the Ocala, and we are committed to giving you the most thorough coverage of the COVID-19 pandemic. Already in the first 2 weeks of school, there are new restrictions on bars, 23 cases in one sorority at Oklahoma State, and mask ordinances still going on in Stillwater at least through November. To talk about it all, and joining me now is Stillwater's Mayor, Mr. Will Joyce. Mr. Mayor, welcome back.
Thanks for having me.
Well, of course, COVID-19 is at top of mind, but just breaking a few minutes ago, at the time of this interview, noon on Tuesday, American Airlines says they're going to start suspending flights out of Stillwater. This certainly affects a lot of the OSU population. Can you brief us on that?
Yeah, I mean it's really unfortunate, and we're working with them and trying to talk with our congressional delegation as well to hopefully mitigate some of that. But it looks like what they announced today was that they suspend service basically just for October at this point, and reevaluate for November. But they're trying to get some additional congressional funding to help support their industry, which has struggled like many others during this time. So we'll be talking with our congressional delegation. It's a great service here. Our numbers have been great. The demand has been really high, and unfortunately, we're at a time with this pandemic that has really hurt the industry. So I'm optimistic we'll get it back.
Ballpark, about how many jobs would you say that creates over at the airport? And do you have like an estimate on the dollar amount it brings into our economy?
I don't have those kinds of figures for you right now, Brodie. It's the airport itself is still busy, with private traffic. A lot of construction going on over there. It's been a very busy airport. And there are a number of folks who work there. I mean, from a city department standpoint, we don't see it having an impact on us, from an employment standpoint. But yeah, in terms of economic development and that sort of thing, the air service has been a tremendous benefit to Stillwater, and it will certainly be something that we're working very hard to make sure stays with us long term.
As much as I'd like to talk about other things, we have to move on to COVID-19. How effective do you feel like your mask mandate has been so far?
It's hard to judge those things. I saw a story in the Tulsa World today with some early research that they've done around the state, that a doctor has done around the state with cities that do have mask mandates showing lower positivity rates. So fewer people who are being tested are testing positive, which is a good thing in cities that have had mask mandates in place. I think about a third, maybe a little bit more than a third of the state population is currently in a city that has a mask mandate. So I think it would be positive to see that expanded, because from what we can tell, overall, it certainly does help.
Last time around, you had some businesses saying people were pulling guns on them, being very aggressive about that. Have you had any more complaints along those lines?
We really haven't. This time, given sort of the conversation, we talked about it a little bit longer ahead of time, gave people a little bit more notice, and kind of changed up the method and the way we implemented it. And the community has responded really well. I mean, anecdotally, I see very strong compliance around town. Certainly, there are still those folks who feel like they shouldn't have to and don't want to be told what to do, which, is unfortunate, because it is an action that really benefits the larger community and not just the individual.
What about over at SMC? Do they have all the PPP they need? Are they in good shape as of now?
As of now, yeah. The shutdown earlier in the year was really sort of prompted by the fact that hospital systems around the country and around the world really weren't in a position to be able to respond like they needed to, and Stillwater was no different. At some points in March and April, they were down to just days, a handful of days worth of PPE available. But as testing has gotten better, and we're testing more and testing faster, and they've been able to build up their supply, they now have hundreds, I think over 100 days worth of supply in terms of PPE, and they're able to use that much more efficiently because they don't have to guess at who has COVID. They can actually test and get results relatively fast now. So they're in good shape. They've been, I think, working extremely hard. I'm very proud of the team at SMC and the work they've done over the last several months to prepare our community for this. which does give us more leeway in terms of how we can respond, right? I mean, with their ability to treat having been expanded now, it gives us a little bit more leeway as a community.
You said in the first part, we closed down initially to help the hospitals who didn't have the infrastructure to do this. I guess, and I know we're still going on, did we flatten the curve like we wanted to? Do you think we succeeded there?
Absolutely, we succeeded. I mean, if you just look at the raw numbers from it's been from March to June, right? When we first moved into shutdown kind of mode, we started shutting things down on March 17th here in Stillwater, and then all of that was opened back up as of June 1st, according to the governor's plan. In that time period between March 17th and June 1st, we had 22 total cases in Stillwater. And we had the last 6 weeks of that period with 0 active cases in Stillwater. Since we've opened everything back up on June 1st, we're well above 600 total cases. Been at one point as high as 175 actives. We've unfortunately lost 3 of our local residents to this disease in that time frame. So, I think it's fairly clear that those drastic measures that we took early certainly helped at the time that they were in place. Now, again, the circumstances have changed a little bit. We're not as concerned about the hospital's immediate ability to treat the community. And so things have loosened up, but I think you're seeing the effect of those looser standards.
So, of course, we still are in a shutdown light. What is the new end game at this point? Is it just a vaccine? When can we say, everyone throw your masks in the trash?
It's a great question, Brodie, and I really hope it's soon, because I know we all want to get back to normal as quickly as we can. It's kind of a question that we'll wait and see what the CDC and the Oklahoma State Department of Health and our local Payne County Health Department and the hospital in terms of how they feel about the spread of the disease. The concerns are around how quickly it can spread and how many sick people may need treatment, right? So at the point, if it's a vaccine, if it's some kind of mutation of the virus or some change in the way it's affecting the population, all of that will go into an estimation of how dangerous it is going to be for our community. And as soon as those medical experts tell us that it's safe, we will certainly move to try to get life back to normal.
Sure. Weedstock is the big story right now. Of course, you may have saw on Facebook recently their headlining act tested positive. He's not going to show up. But the city of Stillwater doesn't have much authority over them because they're outside of city limits. You contacted the county commissioner, the governor. What came of that, if anything?
Unfortunately, not much. We did work with a number of county and state officials to try to find someone who had the authority and the willingness to help us out with that event. And we were told by the State Department of Health that our local health department doesn't have the authority to act in regulating the event. But they also weren't able to identify anyone else who did. So that's a problem. I think just a larger problem from a state law perspective. If there's no one in the state that has the ability to deal with something like this, that the university, the school district, the city, several people around town expressed concerns about what will happen if there's a sort of super spreader event coming out of the tumbleweed this weekend. But evidently there's no one who can do anything about it, which is not a good thing.
One thing you can regulate is bars. There are new regulations, limited capacity, no dance floors or standing areas. You can't stand next to an occupied table. Just like a restaurant, you have to put on your mask until you sit down. But at the end of the day, this is still a college bar. Are you relying on the owners to enforce that, or maybe you're having police randomly check? What are the plans for that?
Yeah, so it is a requirement of the bar ownership to enforce those rules, and certainly we will be checking up and making sure they are doing what they can to enforce those. And that's enforcement has been a topic of conversation throughout this pandemic in terms of different rules that either we as a city have put in place or different states and that sort of thing. It's very difficult when you're talking about these sweeping widespread types of regulations that the community is not really used to. So, we'll do the best job we can. We'll be checking in. We'll be trying to make sure that county health department helps with those sorts of things as well. They've been doing a lot of education to try to help people understand why it's so important to wear their mask and socially distance. So it's some level, Brodie, we can't make everybody make the right decision. There are going to be people who choose not to do the right thing. And we can't chase every single one of those folks down, but we're going to do everything we can to ensure improved safety in our community.
OSU's closing in on their first week. Your children and a lot of other kids in Stillwater started at SBS today. I'm not asking you to be a doctor or predictor here, but are you confident that through Thanksgiving, assuming all goes well, we can have a semester, keep cases low? What are your feelings on that?
Well, you said assuming all goes well, and assuming it does, I think the university and the school district have good plans in place. I think they've done just an incredible amount of work to try to make sure that they can serve their students well in this during this pandemic. And if the community is able to limit the spread of the disease and allow those plans to function the way they're designed to function, I think that the school district and the university can make it through. I think, unfortunately, the concern is just going to be if all doesn't go well, right? If we start to see increasing cases, if the event this weekend has a big impact on increasing cases, and really it's the spread of the disease in the community that those plans rely on staying low, and if it doesn't, if we can't keep it down, then they're going to have to pivot. And I certainly hope that doesn't happen. Those entities out. We don't make those decisions for them. We can't tell the schools to stay open. We can't tell a university to stay in session. But we can do what we can take the actions that we have at our disposal to try to keep the spread as low as possible, so that they are able to execute the plans that they put in place.
Mayor Joyce, I know you're a busy man between your two jobs. Thank you for taking the time. Hopefully, the next time we talk, it'll be about something else.
I'm looking forward to seeing you at a baseball game sometime soon, Brodie.
Me too. All right. Thank you. Have a good one.
Thanks, you too.
There you have it. Mayor Joyce updating us on the latest COVID-19 restrictions, numbers, ramifications, even some Stillwater Airport talk. We'll keep you updated on it all across all of our Ocala platforms. Until then, I'm Brodie Myers. Stay tuned.